Hey future doctors. Welcome back to Scrubs and Study, your one-stop destination for mastering anatomy the smart way. Today's video is super important. We're breaking down something every medical student must understand: anatomical planes, movement terms and directions in gross anatomy. Make sure to like, share, and subscribe because we simplify the tough stuff. Let's start with the anatomical planes. These are imaginary lines we use to divide the body for studying and describing structures clearly. Let's break them down with visuals. 1. Sagittal plane divides the body into right and left parts. If it's exactly in the middle, we call it the mid-sagittal plane. If it's a bit off-center, it's a parasagittal plane. 2. Coronal plane, frontal plane, divides the body into front, anterior, and back, posterior. Imagine slicing bread: front is the crust, back is the slice. 3. Transverse, horizontal, plane divides the body into upper, superior, and lower, inferior, parts. Like cutting a burger in half. 4. Oblique plane. This one's diagonal, any plane that's at an angle to the others. Oblique means that something is not parallel or a right angle. An easy way to remember this is to remember, obliques are odd angles. Terms in gross anatomy. These are the words that help us describe where something is in the body. Trust me, these terms will follow you everywhere in anatomy, surgery, and even clinical practice. Anterior, ventral, front of the body. Posterior, dorsal, back of the body. Superior, towards the head. Inferior, towards the feet. Medial, closer to the midline. Lateral, away from midline. Example: your little finger is medial, and your thumb is lateral in anatomical position. In anatomical position, the midline runs through the center of the body. Structures closer to the midline are called medial, and those farther away are lateral. In the hand, the little finger is medial and the thumb is lateral. Proximal, closer to the center, trunk. Distal, farther away, used in limbs, think of shoulder, proximal, and fingertips, distal. Superficial, near the surface. Deep, deeper inside the body. Anatomical movements. These are the terms you use in every muscle and joint function lesson. Let's go over them quickly and clearly with drawings. Flexion, bending, decreasing angle. Extension, straightening, increasing angle. Abduction, moving away from midline. Adduction, moving toward midline. In case of hand fingers, middle finger is the point of reference. Pronation, palm faces down. Supination, palm faces up. Tip: supination equals holding a bowl of soup. Circumduction, circular movement, e.g. rotating your arm, opposition and reposition, especially for the thumb. Crucial in grasping. Dorsiflexion and plantar flexion, movements of the foot at ankle joint. Dorsiflexion equals toes up, plantar flexion equals toes down. Inversion, sole faces toward midline. Eversion, sole faces away from midline. So today, we covered the language of anatomy, the planes, directions, and movements that will help you navigate the entire human body. If you found this helpful, don't forget to like, share with your anatomy squad. Subscribe to Scrubs and Study for more such smart learning content. Drop a comment if you want a short quiz or PDF notes from this class. Stay tuned for the next class where we explore joints and muscle actions in detail.